This program is brought to you by Hometown Veterinary Partners. Learn how you can get on the pathway to partnership at hometownvetpartners.com/vetcandy.
Hey y'all, it's Dr. Deja. I'm a vet with Hometown Veterinary Partners. We're so excited to collaborate with Vet Candy on this project. Want to know more about Hometown Veterinary Partners and how you can get on the path to partnership? Visit hometownvetpartners.com/vetcandy. Best of luck on your tests. Here's Dr. Shannon Gregoire for tonight's quiz night.
Hey there, I'm Dr. Shannon Gregoire, and I'm a graduate of Western University of Health Sciences and now practice in Massachusetts. It wasn't that long ago when I was studying for NAVLE too. I know how nerve-wracking it can be to tackle these topics, and I'm super excited to team up with Vet Candy to go through some quizzes with you. As we dive into this, I want you to be as interactive as possible. Drop your comments and questions in the chat to participate. We're here to support you, so if you ever need anything, just reach out. Let's get started. Let's get started with question number 1. A 4-year-old dachshund presents with sudden onset of paraplegia. Neurologic examination reveals decreased muscle tone and absent spinal reflexes in the pelvic limbs, with normal thoracic limb function. Where is this lesion most likely located? Is it A, C1 to C5, B, C6 to T2, C, T3 to L3, D, L4 to S4, or E, S1 to S3? Take a moment to think about what answer you'd like to choose and drop it in the chat box below. The correct answer is D, L4 to S4. This region involves lower motor neuron, LMN, signs in the pelvic limbs, characterized by decreased muscle tone and absent spinal reflexes with normal thoracic limb function. Answer A, C1 to C5, is incorrect. Lesions here would show upper motor neuron signs in all 4 limbs. Answer B, C6 to T2, is also incorrect. Lesions here would show lower motor neuron signs in the thoracic limbs and upper motor neuron signs in the pelvic limbs. Answer C, T3 to L3, is also incorrect. Lesions here would show upper motor neuron signs in the pelvic limbs with normal thoracic limb function. Lastly, answer E, S1 to S3. Lesions here would primarily affect the pelvic organs such as the bladder and anus, and potentially the tail, rather than the pelvic limbs. Great, now let's move on to question number 2. A 6-year-old German Shepherd is presented with a left-sided head tilt, circling to the left, and horizontal nystagmus with the fast phase to the right. What is the most likely location of the lesion? Is it A, left inner ear, peripheral vestibular system, B, right inner ear, peripheral vestibular system, C, left brainstem or central vestibular system, D, right brainstem, central vestibular system, or E, cerebellum? Take a moment now to think about what answer you'd like to choose and drop it in the chat box below. The correct answer is A, left inner ear in the peripheral vestibular system. The peripheral vestibular disease typically causes head tilt and circling toward the side of the lesion. The nystagmus fast phase is usually away from the lesion. Answer B, right inner ear of peripheral vestibular system, is incorrect. This would cause a head tilt and circling to the right, with fast phase nystagmus to the left. And choice C, left brainstem of the central vestibular system, is incorrect. Central lesions can cause similar signs, but are often accompanied by other central nervous system signs like conscious proprioceptive deficits or vertical nystagmus? Answer D, right brainstem of the central vestibular system, is incorrect. This would cause right-sided head tilt and circling with potential central signs. And lastly, answer E, cerebellum, is incorrect. This typically causes hypermetric gait and intention tremors, not the described vestibular signs. Alrighty, let's get to question number 3. A 7-year-old border collie is presented with drooping of the right ear, inability to blink the right eye, and deviation of the muzzle to the left. Which cranial nerve is most likely affected? Is it A, cranial nerve 5 or trigeminal, B, cranial nerve 6 or abducens, C, cranial nerve 7 or facial, or D, cranial nerve 8, vestibulocochlear, or E, cranial nerve 9, glossopharyngeal? Take a moment now to think about what answer you'd like to choose and drop it in the chat box below. The correct answer is C, cranial nerve 7 or facial. The facial nerve controls muscles of facial expression, and lesions here can cause ear droop, inability to blink, and muzzle deviation. Answer A, cranial nerve 5 or trigeminal, is incorrect. Lesions would affect mastication muscles and facial sensation. Answer B, cranial nerve 6 or the abducens, is incorrect. Lesions caused here would cause medial strabismus due to impaired lateral rectus muscle function. Answer D, cranial nerve 8 or vestibulocochlear, is incorrect. Lesions here would cause vestibular signs like nystagmus and head tilt. And lastly, answer E, cranial nerve 9, the glossopharyngeal, is incorrect. Lesions here would affect swallowing and vocalization. All right, now let's get to question number 4. A 3-year-old Persian cat presents with ptosis, meiosis, anophthalmos, and protrusion of the third eyelid in the right eye. What is the most likely diagnosis? Is it A, central vestibular disease, B, Horner's syndrome, C, cranial nerve 7 or facial palsy, D, cranial nerve 2 or optic lesion, or E, cranial nerve 3 ocular motor lesion? Take a few moments now to decide what your best answer would be and drop it in the chat box below. You guessed it, the answer is B, Horner's syndrome. Horner's syndrome is characterized by ptosis, meiosis, anophthalmos, and third eyelid protrusion due to the disruption of sympathetic innervation to the eye. Answer A, central vestibular disease, was incorrect. This causes vestibular signs like nystagmus and head tilt, but not Horner's syndrome. Answer C, cranial nerve 7 or facial palsy, was incorrect. This affects facial muscles and blinking, but not the sympathetic pathway to the eye. Answer D, or cranial nerve 2, optic lesion, was also incorrect. This affects vision and pupillary light reflex, but not sympathetic eye innervation. Lastly, answer E, cranial nerve 3 or ocular motor lesion, was incorrect. This causes pupillary dilation and ptosis, but not anophthalmos or third eyelid protrusion. Great, now let's move forward to question number 5. A 5-year-old goat presents with unilateral facial nerve paralysis, ptosis, drooling, and circling. The goat is fed silage. Which disease is most likely and what is a key diagnostic finding? Is it A, thromboembolic meningoencephalitis, TEME, and neutrophilic pleocytosis, or B, listeriosis, mononuclear pleocytosis, or C, polioencephalomalacia and thiamine deficiency? Or D, scrapie and prion accumulation? Or E, tetanus and spastic paralysis? Take a moment now to choose the correct answer and drop it in the box below. All right, you got it. The answer is B, listeriosis and mononuclear pleocytosis. Listeriosis is common in animals fed spoiled silage and presents with asymmetric cranial nerve deficits. CSF typically shows mononuclear pleocytosis. Answer A, thromboembolic meningoencephalitis, TEME, and neutrophilic pleocytosis is incorrect. TEME presents with high fever and respiratory signs, with neutrophilic pleocytosis on CSF tap. Answer C, polioencephalomalacia and thiamine deficiency is incorrect. This causes symmetric signs like opisthotonus and cortical blindness. Answer D, scrapie and prion accumulation is also incorrect. This presents with pruritus and neurological signs, not asymmetric cranial nerve deficits. And lastly, E, tetanus and spastic paralysis is incorrect. This causes generalized muscle rigidity and spasms, not localized cranial nerve deficits. Well, that's a wrap for tonight's quiz time. You guys did great. Thanks so much for joining us. We'll catch you next week. Have an awesome time and keep studying hard.